Okay, so I have been assigned a topic that is a bit overwhelming. When to call your vet regarding all grazing species. So sheep, goats, cattle, pigs, horses, yaks. A little bit overwhelming, and we just have an hour to cover this. So I'm going to try and hit some highlights and hopefully leave some time at the chat so that you can ask specific questions that are of interest to you. Let's see, send my way. So anyway, what you need obviously depends on which animals you raise. So I'm going to begin with sheep and goats because I think that's my field. That the most common grazing animal that this group has is probably sheep and goats. So what are the common problems you encounter is my question to you. I'm going to answer that from my perspective of what I see as a veterinarian as being common problems, but you may have a different take based on your own experience. So all you have to do is drive up and down I-5 and you'll see plenty of limping sheep. Most often that's a foot problem in one or more of the animals. And we'll talk a little bit in detail about differences between foot scald and foot rot. A lot of people use those terms interchangeably when in fact they're actually very different disorders. We see a lot of coughing, heavy breathing, snotty noses, more so in sheep than in goats. I check in animals at the fair every year and I see all these snotty noses in the sheep, and well, I've heard more excuses. Oh, it's the dust or it's hot. Well, most of these animals actually have some respiratory infection. It's not just dust or the heat. Also, we see diarrhea, particularly in around the time of weaning or up until weaning. Not so much in the adult animals, although we do see this in adult animals associated with parasitism or Johne's disease. And then weight loss, which is either acute or chronic. So they seem to shrivel up over a period of a few days, or it can be a gradual onset of weight loss. So if you have other problems that you commonly see, we can certainly talk about those, but I'll try and address these as we move forward. I can get my thing changed here. There we go. So I'm going to start with the limping animals. So you can't diagnose these over the fence. You have to catch the animals and actually inspect them. So if you have sheep, the easiest thing to do is tip them up on their butts unless you have the deck chair or a conveyor belt if you're a large operator. Goats, many times you can put them on a milking stand if they're dairy goats, or just restrain them on their side, or just lift their foot up just like you would for a horse. So it's important to inspect the area between the toes. This is where foot scald and often foot rot begin. It can be reddened or it can be blanched white. And also recall that not every limping animal is going to have a foot problem. So it's important to flex and extend all the joints, see if there's any swelling, heat, or evidence of pain when you move the other joints on up the leg. So obviously you're going to need some hoof trimming instruments and you may need prescription antibiotics. So this is a good time, and I'll emphasize this several times, to actually go ahead. I see an admit here. To go ahead and form a veterinarian client-patient relationship with a local veterinarian. Today, that's the only way you can buy prescription antibiotics. And so that's a sort of a contract between you and your veterinarian, that your veterinarian will oversee the medical management of your animals and be responsible for that, and will provide prescriptions or veterinary feed directives as needed, and be available for follow-up in case there's treatment failures. And a veterinary client-patient relationship remains in effect for 1 year. And basically the veterinarian has to be familiar with your operation, your animals, the environment that they're in, and some of the common problems that you may encounter. So foot scald, you'll see slightly to moderately lame animals depending on the stage of infection. They start out pretty mild, but then can progress to where you see these sheep walking down on their knees. The forefeet are more commonly affected than the hind feet, and the area between the toes may be blanched or red and swollen. So you're looking at this area here labeled skin between the toes. And foot scald can develop pretty quickly. It can be so severe that affected animals are reluctant to stand and move to feed or water, so they can become dehydrated and very thin. They can't keep up with the rest of the flock, so oftentimes they're the ones that the coyotes will predate on. And it can affect both sheep and goats, although we tend to see this more in sheep than in goats. So here on the right, you can see how reddened that is. But the difference between this and foot rot is that this only involves the skin, and it doesn't have that stench like a deer that's been laying on the side of the road for a week in July. It doesn't have that rotten, decomposing stench that foot rot will have. So a little bit of science here. Foot rot is one of the most economically devastating diseases in the sheep and somewhat in the goat industry, but it's different than foot scald. It's actually caused by a synergism of two nasty bacteria, Fusobacterium necrophorum and Diclobacter nodosus. We'll have a quiz at the end. Make sure you can remember these. So lameness is the predominant symptom. And the difference between this and foot scald is this actually gets under the hoof wall. Here you can see this reddened area, and the infection extends down into the keratinized or hard part of the hoof here, and has a very characteristic foul odor. It is really smelly. One good whiff of this and you'll remember it forever. So these are treated with very aggressive foot trimming. If it's a herd or flock issue, foot baths or soaks can be used. Antibiotics are often required to treat these animals. And then moving them to a dry area, consider vaccination, although the vaccines are often not available. And then animals that tend to have chronic or reoccurring incidences of foot rot because they're just genetically more predisposed, or it could be by the way their foot grows, those should be considered for being culled and not used for replacement production. So here's a pretty nasty one. I wish you could smell this. Like I say, you never forget it, but you can see how it's actually eaten down into the horn part of the hoof. And this animal's going to be extremely painful walking down on its knees. And this will need trimming away of all this necrotic tissue, application of either antiseptic or antibiotics, and possibly systemic antibiotics as well. So I'm going to leave that for now and talk about sort of a medical kit for sheep and goats. Usually when people call me and they say their animal's been sick, I'm going to ask them, what is the temperature? What is the heart rate? What's the breathing pattern like? Have you listened to see if the rumen is moving? So obviously you need a thermometer and a stethoscope, and this goes across the board for all animals. So these should be an integral part of your medical kit. For sheep and goats, you're going to need some hoof trimmers and hoof knives. You might need a small scrub brush and some dish soap to clean the debris off of the hoof so you can examine it in more detail, and then dry it with a towel. And then bandage supplies like some gauze, some vet wrap. Duct tape is pretty handy for bandaging feet because it's cheap, it's waterproof, and it's really sticky. So it can be a real lifesaver. Some bandage scissors to cut your bandages. Clippers, electric clippers, cordless preferably, so that you can clip around wounds. If a dogs get into the pen with a sheep or goats and chew them up, you're going to want to clip around all those wounds. Or if they get tangled in the barbed wire and get some cuts, you're going to clip around all those cut areas. Obviously, needles and syringes to administer medications. If you have questions on what sizes are appropriate for what species, we can talk about that. And for parasite control, specifically the barber pole worm, Haemonchus contortus, a FAMACHA card is essential. You can obtain these by online training from University of Rhode Island, or you can come to an in-person course and become certified in FAMACHA. So drenching syringes, it surprises me that a lot of people don't have these. If you're needing to treat coccidiosis or something with a drench or a dewormer, it's important to use a syringe that gets all the way to the back of the tongue, and then when it's swallowed, it goes right on into the rumen with a drenching syringe. So some wound spray. We like to use Alu Shield, which is a waterproof bandage. The wound sprays like Blue Coat and well, you can't use nitrofuran or furazone spray on food animals anymore, so that's out of the picture. I haven't had much luck with Blue Coat other than you can see that the owner noticed that wound because it's got blue all over it. If you have lambing or kidding coming up, some obstetrical lube, and then a surgical prep solution like betadine or Nolvasan, which contains chlorhexidine, is good for cleaning around wounds. If you're having any problems with bloat, a stomach tube and a little speculum to keep the animal from chewing the tube in half is good. And a product called TheraBloat, which contains paloxylene, particularly is good for a frothy bloat or a lagoon bloat. And then unfortunately, some animals are not salvageable. And so if you're going to euthanize those animals yourself, you'll need either a captive bolt, which I doubt many people will have, but most people do have a rifle, and it's important to learn the spot to go ahead and shoot an animal to quickly dispatch it in a humane manner. For antibiotics, again, see your veterinarian, establish that veterinarian client-patient relationship. It doesn't mean your veterinarian has to see every animal that you treat with an antibiotic, but he or she will have to write a prescription for you to obtain these antibiotics either from your veterinarian or from a distributor. Obvious things like a halter, restraint is really necessary. It's pretty hard to treat and examine animals on the run, so getting them restrained is important. And you might want to have something like Ziploc bags for fecals. If you're using any Banamine or Flunixin, which is the chemical name, remember that this product should be given IV. If you can't give an IV injection, you shouldn't be using Banamine. You can use other anti-inflammatories, anti-pain drugs like meloxicam, but Banamine must be given IV or the withholding time is extremely long. All right, let's see. For some reason, I'm not changing the screen. Okay, so when to call the vet. So generally, as a rule, sooner rather than later. I get so many calls. Usually it's a client that we don't have a relationship with. They've been shopping around for 10 different veterinarians. Nobody will see them. And I get the call, and by the time I see the animal, I kind of make a joke of it, or a wisecrack, and I say, you really should have called a priest rather than a veterinarian. This animal can't be saved. So now you've got a dead animal, you've got a veterinary bill, nobody's happy. So when in doubt, go ahead and call the veterinarian. And even if it's just to talk to the veterinarian, let the veterinarian know what the situation is, and they'll advise you whether it needs to be seen right away, whether it can wait till morning, or whether it's something you can handle yourself with some guidance. So again, establish that veterinarian client-patient relationship. You don't do that in the middle of the night. You call the veterinarian out to make an appointment, to inspect your animals, to look at your facility, to go over what your goals are, what sorts of disorders you have common on your operation, and that will establish that relationship that needs to be renewed annually. It should be a written and signed document that is kept on file by both of you. That's the law in Oregon. So when to call the vet? Limping that hasn't responded to treatment within 3 days or so, probably a good idea to get those animals examined and find out exactly what's going on. They may need to have a more in-depth examination or maybe even some x-rays taken. Any animal that has a poor appetite. Our grazing animals are designed to eat. For example, horses are made to graze 16 hours a day. And so any animal that's a grazing animal with a poor appetite, there's something wrong. And also remember that all of our grazing species are prey animals. So they really hide their signs of illness or disease or injury so that they don't become, just bait for the coyotes and the mountain lions. So they really are adept at hiding any signs of sickness, illness, or disease. But one of the first things you'll often see is a poor appetite. So bloat that's not readily resolved, bloat can obviously be very fatal. And so having the equipment and things like TheraBloat available to you to treat that is necessary. But when you pass a tube and you don't get that gas rushing out, then obviously it needs veterinary attention. They may actually have to do a ruminotomy to resolve that. And time is of the essence. Suspected plant poisonings. This is the time of year when a lot of these plants are coming up. Things like laurel, which also includes azaleas, and rhododendron has the same toxin. This time of year or in the next month, we see larkspur coming up, and a lot of times you'll see those animals, they're just dead down in a ditch where the larkspur is growing. A little bit later in the year, we see water hemlock or spotted hemlock. It only takes a few bites of this stuff to kill an animal. So if you find animals that were apparently healthy one day and dead the next, make sure that you walk the pastures and look at the plants and see what plants have been nipped off. And if you can't identify the plant yourself, go ahead and grab a couple samples and either have your veterinarian or a botanist identify those plants for you. We've got a lot of poisonous plants here in Oregon, and so it's kind of a jungle out there. So scours with poor appetite or weight loss. A lot of times this is simply parasites, but remember, for years we have overused our parasite control drugs, and now we have widespread resistance. So you may have dewormed that animal a week ago that can still die of parasites. Heavy, rapid, or labored breathing is a sign of pneumonia, and should be seen by a veterinarian. They may need to do some cultures or ultrasound or x-rays to get to the bottom of it, and recommend some appropriate antibiotic and anti-inflammatory therapy. Anything that has pale gums, either the eyes, the conjunctiva, or inside the mouth, or the vulva in the case of females, that would be an indication of anemia. Mr. Pirelli mentioned things like a copper deficiency can cause anemia. In our area, often it's due to parasites, but also liver flukes can cause anemia. See that more in sheep than in goats. And then I could spend the whole evening on obstetrical issues. That happens to be my specialty, obstetrics and fertility in animals. But any animal that's overdue by more than a few days, it could be the fetus is dead, or the fetus is simply overdue and they're still growing, and may be an indication to induce labor before the animal or the fetus gets too big to be delivered. If you've had sheep or goats, twin lamb disease or pregnancy toxemia, ketosis, that's really hard to turn around, and it's usually mitigated by appropriate feeding during pregnancy, not allowing animals to become too fat or too thin. When we do treat those, it's often kind of a toss-up, trying to save the mother. If we can keep the babies in there for a few days and then induce labor or do a cesarean, we can often save both. But in many cases, we end up losing both because the owner's bent on saving the babies when they're not due for another month and the mother's already down and off feed. The best thing we can do in those cases is go ahead and sacrifice the babies, do a cesarean or induce parturition with drugs and get those babies out. At that point, they're functioning like a giant parasite, draining the nutrients from the mother. And as pregnancy goes on, it just gets worse and worse. Obviously, prolonged labor, by prolonged anything that's got active straining for much over an hour or so, that doesn't apply to swine. They can often go 4 to 5 hours to produce all the pigs in their litter, and that's normal. But any prolonged labor, more than an hour or so without progress, would be an indication to call for help. And then straining without progress, again, it could be a breech presentation, so they're straining, but nothing is showing at the back end. So that would be an indication to check those animals out or seek professional help. And anytime you see an abnormal presentation, so you have a head and one leg, or just a tail sticking out the back end, would be an indication for obstetrical intervention. Depending on your skill level and experience, you can maybe handle that yourself, or if not, then call a veterinarian for assistance. Okay, so on to cattle. For this discussion, I'm assuming that most people have beef cattle, not dairy cattle. So I'm going to try and kind of limit the discussion to beef cattle. So the common problems I see, pink eye. We see this predominantly in the warm season when fly activity is active, but we also in recent years have been seeing a winter form associated with a little bit different bacteria, particularly when the cattle abrade their eyes by diving into big round bales. They stick their heads in there, and the plant material in the round bales actually abrades the cornea and sets the stage for an infection leading to pink eye. Not as much as sheep and goats, but we also see limping in cattle. Occasionally foot rot. Here we do live in Mud Valley, so foot rot can occur in cattle. It's actually more of a common problem in feedlot cattle that become laminitic from the heavy grain diets, but we can see that here as well. Cows that get down post-calving, that's usually an indication to call the veterinarian. And so it could be musculoskeletal. She broke a leg, dislocated a hip. More often and not, it's metabolic. Jean mentioned grass tetany, which is fairly common in the springtime. Also, low calcium, milk fever, hypocalcemia. And oftentimes it's a combination of low calcium, low phosphorus, and low magnesium, and even sometimes low potassium that's making these cows down. So my approach to these is first thing I do after examining the animals, I take a blood sample and just stuff that in my pocket. I go ahead and treat the animal on a presumptive diagnosis. And if it doesn't respond to treatment, then I submit that sample to the lab to find out what mineral might be deficient, what I've missed, what I might need to supplement in a greater quantity than sort of a shotgun approach. So obviously coughing, bovine respiratory disease is the most costly disease in the beef cattle industry, particularly around weaning and whenever cattle are moved to about backgrounding operations or feedlots. They're often commingled. They may go through a sale barn. They're highly stressed. They're exposed to pathogens they haven't seen before and don't have any immunity to. So coughing, hard breathing is a real problem that needs to be treated. This is one of those diseases you need to treat the day before they get sick. And actually a really astute cattleman can see that calf that's starting to get sick. Maybe the ears are held a little bit lower. Maybe the hair is fuzzed up a little bit. Maybe it's standing with its back arched. Maybe it's breathing just a little faster than its contemporary herd mates. And that's an indication to go ahead and catch that animal, check its temperature, and go ahead and institute treatment with appropriate antibiotic therapy. This time of year, we see a lot of scratching, hair loss, mostly from lice. Lice can really take their toll on these animals. We have two types, chewing lice and sucking lice. The chewing lice just irritate the animal. They feed on dander, but the sucking lice actually penetrate the skin and live off the body fluids. And it's a good idea to either use a broad spectrum treatment that will kill both or identify which type of lice you have. So obviously, if you treat with some of the topicals for the lice that just feed on dander, that's not going to be effective for sucking lice, only for chewing lice. So they're really easy to tell the difference under the microscope by looking at their mouth parts. And if you can catch a few of those guys on their hair, drop it off at your veterinarians to take a look at it, and they can direct therapy for that. Obviously, weight loss, if you have a group of animals and one's just not gaining weight like the others, or it has a weight loss different from the other animals, not just winter weight or lack of adequate nutrition, but some issue going on. It could be parasites, could be Johne's disease, could be lymphosarcoma, just a whole plethora of different abnormalities. And by the way, those calves that get pneumonia, if they get really sick, obviously that's going to affect them their entire life. Those calves often never really catch up, and they'll kind of be poor doers throughout their productive career. But the sooner you can catch those, the less negative impact it will have on that animal for the rest of its life. So dystocia, I'm just going to put a pitch in here. We have 2 calving schools coming up next month in Corvallis. If you aren't skilled at delivering calves, this would be a good teaching moment for you. They'll be held right here on campus, and there'll be 2 of them, and you can find those on the extension website. Mastitis is relatively rare in beef cattle, although much more common in dairy cattle, but we do occasionally see really severe mastitis cases, either gangrenous mastitis or coliform mastitis that can make the animal sick, even sick enough to die. So uh, anytime an animal that is, particularly if she's nursing a calf or she has just weaned her calves, make sure you can catch her and check that udder, see if it's hot and hard, express a little bit of milk from each teats and see if the milk looks normal or whether it's got clumps and clots or whether it's straw colored that would indicate a gram-negative infection. So pink eye, we see this quite a bit in pasture cattle, usually in the summertime when fly activity is high. This is really a welfare issue. These animals are extremely uncomfortable. They don't want to eat. They're flicking their heads. They're squinting. Obviously, this one on the right has got an abscess in the cornea. Can't see anything out of that eye. Once in a while, we will see this in the winter, as I mentioned, when cattle are poking their heads into big bales. And so you're going to need some injectable antibiotics. We have several approved antibiotics that are approved to treat this condition. Again, the earlier they're treated, the better. If you can move the animal to a shaded area under a shed, the sunlight really hurts these animals and makes them squint even more. You can use the eye patches. And I will say, if you use patches, either homemade out of blue jean material or the commercial shut-eye patches, you don't want to glue that all the way around the eye. You want to leave it open at the bottom so drainage can occur. And every once in a while, you want to catch that animal every 4 or 5 days and lift that patch up, make sure there's not a bunch of maggots under there too. And then obviously fly spray, not only for around the eye, but for the entire animal. So limping cattle, again, could be foot rot, a hoof abscess, more common than foot rot, or the problem could be higher up the leg. Unfortunately, most beef cattle are not like a horse where they'll stand for a farrier. So it either takes a rope and casting the animal, and I'll show you how that's done. It's not quite as complicated as you might think. Getting that animal where you can actually pare out the foot, get a good look at it, and see what the problem is. So you need be able to restrain the animal either with a lariat or a tilt chute, some hoof knives, and some bandage material. So if this movie works, hopefully, to show you how to cast a cow.
The 2-half hitch method for laying the cow down on top of her back, and it goes down her back right here. And they're going to lay her down. Okay, go ahead and lay her down, pull on the cow. And they're pulling on the chains on the calf to make her have a contraction at the same time. And there she goes. That's what we want. Okay, let her lay there for a second. And then put her flat out on her right side. Okay. Good. That's where you start delivering the cow.
Okay. So, at that point, well, a couple points here. One is the animal needs to be haltered and tied down low to a stationary object because when they lay down, their head's going to be low. And then this rope around the neck, it shouldn't be a Honda like that slips. It should be like a bowline that can't be tightened. And then the first half hitch goes over the withers, the second one just in front of the udder, and then apply tension on the rope and she'll lie down. And then it's helpful to have somebody sit on her head and you can tie that rope to itself to maintain tension and hold that cow down while you examine the feet. So if you don't have a chute and your cattle aren't too crazy, this is one way you can get those feet in a place where you can look at them and handle a lameness issue. So first aid kit for cattle, obviously some way to restrain them depending on the nature of your cattle, either a chute or a halter and a sturdy post if you can get a halter on them. Again, a thermometer and a stethoscope. And remember that these are ruminants. And so it's important to not only listen to the heart and lungs, but also on the left side behind the ribs take a minute or a full 2 minutes, put that stethoscope on the rumen and listen to the contraction. It sounds kind of like a toilet flushing, and you'll actually feel the rumen move. If it is moving, it will push the stethoscope out, and then it'll make a gurgling sound and sink back in. And you should hear about 2 rumen contractions per minute. If the rumen's moving, she's not particularly sick. That's really a good barometer of health. And this applies not only to cattle, but sheep and goats as well. Again, some hoof tools, nippers, hoof knives, foot bandage material. You might need some Telfa or nonstick adherent pads, some roll gauze, some vet wrap, and again, duct tape to make a waterproof bandage. If you're going to be giving any medications and you don't have a scale, you can use a weight tape to help estimate the weight, syringes and needles, some blood tubes, syringes and needles. You might, a down cow, again, take a blood sample before she's treated to help get an idea that if she doesn't respond, what the problem might be. A balling gun for administering oral medications. And you may not be familiar with this term, a frick tube, which is just a metal tube to stick in the mouth and over the base of the tongue so that you can pass a stomach tube through that. And she can't chew it in half, so that a bloat can be relieved or a drench can be given. Oops, sorry. And then some clippers, cordless clippers, a bucket or a hose with some clean water, some surgical scrub if you're going to be doing a obstetrical lubricant, and then of course chains and handles. And then if you get a nice live calf, you want to dip that navel in a disinfectant like betadine or strong iodine. And then in your medical kit, you'll need appropriate antibiotics, deworming drugs, pour-on for lice and flies. And then remember that in cattle, we now have a pour-on Banamine or Flunixin, so that gets you out of the having to give an IV injection to give an anti-inflammatory. So you can buy the pour-on Banamine from your veterinarian or by prescription from a veterinary supply company. So cattle, when to call the vet? If it's this time of year where it's fairly cool, if the animal has a fever over 102, they either are sick or they're about to get sick. So if you don't have an accurate diagnosis, call your veterinarian to help make a diagnosis. Normal cow heart rate is usually between 60 and 80. So heart rate over 80 is an indication that there's a problem going on. It could just be pain. It could be pneumonia. Lots of reasons for elevated heart rate. As I mentioned, that rumen is a barometer of health to cattle and other ruminants. And so if you hear no rumen sounds at all, that animal is obviously sick. If she's unable to stand up, again, it could be a musculoskeletal problem or a metabolic problem or an infectious problem like mastitis or a uterine infection. Ruminants are made to eat, so any ruminant that has a poor appetite should be examined to find out why. And then if she has liquid manure or dark manure, unless she's on really lush grass or a high grain diet, that would be abnormal. And you can certainly compare one animal to the other to determine what's normal. Severe hair loss could be from lice, or it could be a mineral deficiency or a mineral excess. Mr. Pirelli talked a lot about selenium and how narrow the therapeutic index is. In other words, if a little's good, more's not necessarily better. And one of the signs of selenium toxicity is hair loss. Any difficult calving, so heifers should be able to have their calf within an hour of appearance of a foot or the water bag. Cows generally deliver their calf within 30 minutes. And so if they exceed those times, then it may be time to intervene. If there's any limping with swelling above the coronary band or elsewhere further up the leg, could be arthritis or sepsis in the joint or a fracture. And so that would probably be something the veterinarian would attend to, usually by taking some x-rays. So it's good to have a veterinarian has a portable x-ray machine, usually digital, so you can look at them right on the spot. So some equipment, there's obstetrical equipment, a clean bucket, warm water is a real luxury, obstetrical chains, various types of lubricant, either water soluble or a non-water soluble like Vaseline or Crisco, some surgical scrub to clean the area around the vulva, and then some handles. Okay, horses. Oh my gosh. Horses, there's no end to the ways they can get sick or hurt. This is a horse I saw in emergency this last weekend. It had this big swelling behind its jaw. Eventually, it wasn't strangles, turned out to be an abscess. But this guy had a fever. He wouldn't eat because it hurt to eat. That was kind of an oddball thing. So any horse that shows signs of colic, so they're down, they're rolling, they're looking at their sides. Horse that has a fever, horse's normal temperature is a little bit lower than our other species. It's usually under 100. A horse that doesn't eat off feed, that's a sick horse. Obviously, severe cuts, and by cuts that are deeper than just the skin into the muscle layer or bone exposed are really important injuries to be taken care of, particularly if they're near a joint, because some of these cuts will extend into the joint, and then you can end up with a septic joint and a horse that's no longer useful as an athlete of any kind. Eye issues, you saw the pink eye in cattle. If a horse was like that, it'd be throwing itself down and probably lose the eye totally. A horse eye is much more delicate than cattle eyes, and any little speck on the eye or squinting or excessive tearing should be seen right away. Those things can cause ulcers that can melt and ruin the eye within 24 hours. So they are an extreme emergency in a horse, much more so than in cattle. Any abnormal lumps, bumps, or swellings should be attended to and a diagnosis made. A lameness, a severe lameness, or a horse that's unable to get up. And then rapid breathing could be heaves, could be pneumonia, could be allergies, lots of different causes. So obviously you would want to have an accurate diagnosis so the therapy can be targeted toward that diagnosis and be effective. So colic, this is one of the most common complaints I get when I'm on emergency duty. So first thing to do is go ahead and remove the feed. A lot of times the feed in a colicky horse will just ferment and not move through the digestive tract. You can try to prevent the horse from rolling just by walking it slowly, but it doesn't mean walk the horse for 12 hours. There's no use making a horse exhausted when it's already sick. But sometimes keeping their mind off their pain by some walking will help keep them from rolling. Be sure when you call the veterinarian to take their vitals. The veterinarian is going to want to know what the heart rate is, what the temperature is. Listen for gut sounds in all four quadrants on both sides. Check the gums for color, and the capillary refill time should be less than 2 seconds. Has the horse been pooping? And how about its mentation? Is it bright and alert, or is it acting sort of obtunded or depressed and just hanging its head? That will help your veterinarian determine the severity of the colic and whether it needs to be seen immediately, or maybe you can just medicate it at home and wait a little while to see if the horse recovers. So obviously pain medications. Banamine works better for colic than bute or phenylbutazone. Bute's probably better for musculoskeletal injuries. So it's important to take those vital signs before you give the Banamine, because Banamine will hide a lot of signs. It will cause the temperature to come down. So at least take those vital signs and record them before you give the Banamine. A lot of times, by the time I get to see the horse half an hour later, it looks pretty good. And it looks pretty good for 3 or 4 hours till the Banamine wears off. So I like to know what that horse looked like before I see it and before it actually has the Banamine. So call the vet if the heart rate is over about 56. Most horses have a heart rate, 40 or 44. If you hear no gut sounds on either side of the abdomen, and if the pain is not mitigated within about 45 minutes after giving some oral Banamine, that horse needs to be seen. And this is one of my pet peeves. Have a truck and trailer ready to go. Doesn't mean you need to own it, but if you don't own a truck and trailer, you ought to have an agreement with a neighbor. If your horse needs to be transported to a veterinary facility, have that ready to go. I don't know how many times people call with severe colic. It's a colic that would be much better treated in the hospital with 24-hour care. And they say, oh, their truck's broke. They don't own a trailer and they want me to come out. Well, I do the best I can, but it can make a life or death difference if you can haul that horse into a facility where it can be properly and intensively treated. So If it were up to me, it would be a state law that anybody that owns a horse has to have a trailer available. But unfortunately, it's not up to me, and I don't think our governor much cares either. So that'll never come into being. Let's see. Horses. So what do you need? Truck and trailer available. Not necessarily own it, but have it available. A stethoscope to listen to the heart rate, listen to gut sounds, listen to breathing. Clippers for wounds. Some surgical prep solution. Notice that I said prep solution, not scrub solution. So things like chlorhexidine or povidone iodine, they come in both a solution and as a scrub with a detergent. The detergent will actually kill those tender cells. And so we want to use just a prep solution, and it should be diluted down, and I can give you some instruction on that. Bandage material for the hoofs or for the legs, a flashlight. So, horses tend to get sick at night, so you want to be able to look at their eyes, look at their gums. Some drugs to have available would be phenylbutazone, pain relievers, Banamine or Equiox. Antibiotics, usually we use something like Exceed or Procaine Penicillin G. Some topical wound spray or ointment, we can talk about some of those. A horse blanket, a lot of these horses will start shivering and be cold. If you're going to have to move that horse, you want shipping bandages for the legs. And if it's a foaling mare, obstetrical chains and handles. Your best chance of getting a live foal with a difficult birth is to handle it on the farm. By the time you load a horse and bring it into the hospital, or by the time a veterinarian gets to your farm, chances are that foal's dead. Birthing goes really fast in horses, 20 to 30 minutes. If it takes more than an hour, you're going to lose that foal. So I want to spend just a little bit of time on wound care because most wounds are not treated appropriately on horses. So the initial wound care can make a big difference in the outcome. So we can use antiseptics to clean the wound. And so your mama was wrong. Hydrogen peroxide is not something to pour into a wound. It bubbles and fizzes. And during that bubbling and fizzing process, it's killing a lot of cells. It's a cytotoxic compound. So it has no place in caring for wounds except in really deep puncture wounds. Like a nail that went into the shoulder, infusing peroxide would be appropriate there, but that would be the only case. Povidone iodine, use the solution, not the scrub. And you want to take the stock solution and dilute it. So 20 mLs of the stock solution in a liter or a quart of saline. Notice that's saline and not tap water. So here's some 0.9% sodium chloride. So you could make your own by adding salt to distilled water to be really cheap. But tap water, again, because it's hypoosmotic, is going to kill cells. The chlorhexidine solution, you take the stock 2% and add about 25 mLs of that to a liter of saline. And it's actually better than the povidone iodine. It's less cytotoxic and has a more prolonged killing effect on bacteria. Vetricin's become really popular in the last years, and it's a chlorine derivative, and it's actually good for initial wound cleaning. So you don't have to mix it, you don't have to dilute it. So that's kind of a standby for most horse people. Remember that shampoos and scrubs are cytotoxic, so don't use those for wounds. And what you see here is just a big syringe with an 18-gauge needle. So you can fill that with your wound cleaning solution and spray it in there under some pressure to help lavage and remove the debris. So a setup like that can be really helpful. Let's see, sorry about that. So wound care, again, blue coat is not the best. Topical antimicrobials, a lot of people will use triple antibiotic. You can buy that at the drugstore, but it may actually end up delaying wound healing. So it's not the first line choice. Silver sulfadiazine, which is commonly used for burn victims because it has a very broad spectrum, particularly against the gram-negative like Pseudomonas. A 1% ointment, and it can be applied under the bandage. If you don't apply it under a bandage, when it gets to body temperature, it just kind of liquefies and slides off. So usually slathering a bunch of it on a Telfa pad, putting that on the wound and then wrapping it is the way to go with this. I call this sugar dine. It's just a mixture of povidone solution and sugar. That's a favorite for hoof abscess. So you can use a baby diaper, put a big wad of sugar dye on the diaper and use some duct tape to attach that to the foot that might have an abscess, and it will help draw that abscess out. In the last several years, honey has become popular for wounds, um, but most honey that you either raw honey that you just get from a farm stand, about 30% of the samples are contaminated with some pretty nasty bacteria, actually. So the recommendation is for Manuka honey, and if you can find medical grade honey, that would be the safest. And honey is great for the first 2 to 3 weeks of healing. It's gooey, so no bandage is needed. It will help draw out edema, swelling. It's bactericidal, and it has some kind of unique growth factors that really facilitate the initial healing process. Nitrofurazone, the yellow spray or the yellow goo, we've used that stuff for decades, but we have way better products available now. Again, nitrofurazone is cytotoxic to epithelial cells. So a wound like this, you see this little rim of new cells trying to grow across to close this wound. Nitrofurazone will kill those cells and actually delay wound healing. So there's way better products to use. One of the things we've started using is this Alu Shield. It's a waterproof spray bandage. It does contain aluminum. It looks really cool. It looks like a space suit when you spray it on a wound, but it'll protect the wound, and the aluminum does have antimicrobial activity. Okay, so I hope I've left some time for questions. We have about 13 minutes before top of the hour, so I'm sure that some of you have questions on things that I haven't either explained clearly or not covered at all. So I'd like to open it up now for questions.
Thank you, Dr. Estill. You can go ahead and put those questions in the Q&A or the chat, and I can ask them out loud.
Great. I must have really bored everybody. They asked Gene a lot of questions.
I think you're thorough.
I don't know. This was a really broad topic, and I just kind of hit the high points.
Thank you for taking on the challenge. I know it's real hard to cover that much stuff, but I appreciate it. All right, this is a quiet group now. Unless my internet's down or something, I'm just not getting anybody's messages.
Yeah, it says there's 18 participants.
If anybody's brave and wants to ask a question. Oh, all right, we got one.
Oh, great.
All right. I know that grass sickness is an issue in England. How about here in the US?
Oh, gosh. I'm not real knowledgeable on that. I think what people are calling grass sickness is an allergy to certain pollens and proteins in the grass that can cause swelling, usually behind the jaw, sort of like that horse that I showed you initially that ended up with an abscess. And I actually have not seen that here in Oregon, but I've seen it reported. It's way out of my area of expertise as a reproductive specialist, but my recollection is that it's an allergic reaction to compounds in the grass, and it can cause swelling in the parotid area behind the jaw. And it's usually just treated with some antihistamines or changing the forage. And that's the best I can do on that question. I'm just not real knowledgeable on that topic.
No, that's a great answer. All right, we have a few more. Are some wound care for horses also okay for other species? For example, the honey to use on goats?
Absolutely. Yep. The honey, diluting the povidone or the chlorhexidine in saline, not tap water, avoiding detergents. The same principles apply to ruminants or swine. They're not quite as sensitive to the cytotoxic effects. Horses are so prone to exuberant, proud flesh or granulation, and a lot of the older products really promote that. We don't have that problem so much in the ruminants, so we can use chemicals that are a little bit harsher, but all the things that I mentioned for horses would certainly be appropriate for our other grazing species.
Okay, I also have two comments. This one's from Brad. Absolutely a great presentation for us novices. As a result, I have a good basic knowledge.
Thank you.
And Kristen says, thank you. This was very thorough. And then we do have another question.
Okay.
Can you talk more about preventing founder in horses and some early signs to look out for?
Sure, don't buy ponies and minis. That's the first step. Founder, boy, that's a tough one. We see several different types of founder. You know, in the old days when we had carriage horses, they would get street founder just from pounding on the pavement. We don't really see much of that anymore. We often see founder in the springtime when our grasses are growing rapidly and horses that have not been accustomed to eating fresh grass get turned out and they chow down on the fresh green grass because it's so yummy. Um, One way to help prevent that, particularly in the spring or in the fall when we get that luxuriant regrowth, fill them up on hay before you turn them out, and then they're not going to eat quite as much grass. Or use grazing muzzles, or just limit the time that they can go out there. You know, start with 10 or 15 minutes, bring them back into a dry lot or feed them hay. The other thing is secure your grain. A lot of founder cases I see is because the horse got into the feed room or knocked the lid off the grain barrel, or somebody left the bag in the hallway, and somehow the horse reached over the stall or got into it and engorged herself on 15 or 20 pounds of grain, and they get into all kinds of problems, founder being one of them. The other case in which we see founder is secondary to severe infections like pneumonia or uterine infections, but those cases we try to prevent founder by putting them in ice boots. If you have a nice cold stream with a muddy or sandy bottom, you can stand the horse in that if you see any beginning signs of founder. But the big things are limit grass consumption in the spring and fall, and don't let the horse get into the feed room when it's not supposed to. And then again, the ponies and minis are so susceptible to founder, so taking extra precaution to prevent that dietary overload with carbohydrates is a really big deal with them.
Perfect. All right, this group's now starting to warm up. We got a few more questions here.
Oh, okay.
What are the top concerns to look out for with pasture pigs and llamas?
In the same pasture?
Oh, I don't know, maybe not necessarily in the same pasture, but in general, you know,
Well,
kind of what are maybe
well,
some common things to look out for?
Pastured pigs, because of their environment, are subject to parasitism that is usually not an issue when they're, you know, raised in either a dry lot or on concrete or on, mesh, like in a commercial swine operation. So parasites are a big thing. The other thing, believe it or not, in light pigmented pigs is sunburn. People forget that pigs can get sunburned very easily. So either providing shade, or you can use your SP45 on your pigs in the white areas as well. Those are the main things I see in pasture pigs. Um, pigs don't Pigs are not designed to live by grazing. They're omnivores, and so if you're trying to raise them for meat, they actually need a concentrate in their diet, a corn, soybean, or a grain-based diet. They grow really slow. I mean, we raise our commercial pigs to 300 or 320 pounds in about 5.5 months. And I see pasture pigs that are 2 years old and they weigh 180 or 200 pounds. So they'll live, but they don't grow very fast if your goal is to produce meat on pasture. Obviously, Idaho pasture pigs, coonies, um, uh, American guinea hogs, they do pretty well on pasture, but they're going to grow a lot better if you supplement their feed with some grain and a mineral mix. And then as far as llamas go, um, they're a different critter. Uh, so parasites is a big problem. The meningeal worm, particularly as we move further east in Oregon, where they have contact with white-tailed deer, the meningeal worm causes neurologic signs and paralysis. But again, here in Western Oregon, the biggest problem I see with both alpacas and llamas is parasites, coccidia, and stomach worms and worms that parasitize C3, the equivalent of the rumen. So parasites. And then we also see animals that are just neglected. Those animals need to be shorn at least once a year. or they get really shaggy and gets nasty under their skin, and they develop rain rot and things like that. So parasites are the big things now. I hope that answers your question. It's all I can think of off the top of my head right now.
And then last question we have is, are there any special dietary needs for stallions prior to breeding season?
Oh
Yes,
boy.
that's more of a nutrition specific, and I
Yeah.
can also share resources afterwards, but if you have anything off the top of your head.
You know, a lot of horses, particularly performance horses, are fed all kinds of weird foo-foo dust. You know, I go into barns and I look at the feeding instructions. I get a cup of this, a scoop of this, a pinch of this. There's like 5 or 6 different things. But basically, good quality hay like orchard grass or some alfalfa or a grass hay mix, um, a mineral supplement, which can be top dressed on a little bit of grain. A stallion that's heavily breeding is going to use a lot of energy, so they may not be able to maintain their weight with just hay. So adding some a complete feed that's made to supplement a forage is adequate. Um, there are a lot of supplements out there for stallions. Most of them contain omega-3 fatty acids, usually in the form of fish oil or linseed or rapeseed oil. Those have been shown to help some stallions that are used heavily, but most stallions don't need that. We usually implement those strategies where semen quality diminishes over time, and we're just trying to get them through a breeding season until they can kind of recharge. So basically, good quality forage, a forage balancer with minerals and vitamins are all a breeding stallion really needs. Not a lot of foo-foo dust.
All right, I think that is it for our questions, and just thank you so much for teaching a session and just sharing your wealth of knowledge. We really appreciate it, Dr. Estill.
My pleasure. And any questions, as well as Gene, I'm easy to reach, charles.estill at oregonstate.edu. So I'll be glad to answer any questions. That's part of my job. So don't hesitate to ask.